Hello, and welcome to the April edition of Pulse, the monthly webcast produced by the Indiana State Department of Health to keep Hoosiers informed of events and health trends in Indiana. I'm your host, Megan Wade-Taxter. April is National STD Awareness Month, so today we'll be talking with Dennis Stover, Director of our HIV, STD, Viral Hepatitis Division, about how to best prevent sexually transmitted diseases. So welcome, Dennis. Thank you for joining us this month.
I'm pleased to be here. I'm great to be celebrating STD Awareness Month.
Yes, so with that being said, I know your division works to educate Hoosiers about how to prevent STDs. Can you tell us a little bit about the Sexually Transmitted Disease Prevention Program?
Sure. We're in 12 different regions of the state representing every county. We work with local health departments and some nonprofits throughout the state that provide good services. We provide them financial resources, technical assistance, and we also train folks that work in the field called disease intervention specialists. These folks are the frontline workers. They're doing the tests, they're notifying partners, they're getting people into services.
Okay. And what are the most common STDs we see in Indiana residents?
Three most common are chlamydia, gonorrhea, and syphilis. Syphilis is on the rise because of its infectiousness and the amount of syphilis that we have out there. In public health, we try to stop the spread of disease, so we stop the spread by educating the clients of their risk factors and get them into testing.
Nearly 1/3 of pregnant women in Indiana do not receive prenatal care, including being tested for sexually transmitted diseases during the first 3 months of pregnancy. A lack of prenatal care puts the health of mothers and babies at risk and contributes to Indiana's infant mortality rate. Infant mortality is defined as the death of a baby before age 1. In 2016, 623 Indiana babies died before their first birthday. So what kinds of risks do STDs pose to moms and babies?
Huge risk to mothers and babies. We recommend testing before you think about getting pregnant so that you do not have an STD that you are carrying into your pregnancy. If a mom has an STD in pregnancy like syphilis, it can pass through the placenta to the baby, and then the baby has risk of harm and infection as well. It can attribute it to low birth weights, stillbirths. It is one of our ways to stop infant mortality is to make sure the mom knows her STD status before she gets pregnant. So along with that, premature birth, so they can be born early and require a lot more care. Some STDs can be treated with antibiotics, which is kind of normal, and you're treated and then you are cured of that STD. Others are treated with antiretrovirals, which stop viruses.
And those are safe during pregnancy?
Yes, most are safe and will not harm the mom. Docs will advise you on which drugs you can and cannot take.
Okay. So speaking of testing, I know our One Test, Two Lives program is working to raise awareness about the importance of getting tested for HIV before even becoming pregnant. So what can you tell me about the risk of an HIV positive woman passing that virus to her unborn baby?
Fairly high risk if she's not tested and treated. So we have had very good education around this for a lot of years in Indiana. So we've had very few infections that have transmitted to the baby, less than 10%. So that's a good public health marker of something that's working. The One Test, Two Lives is very important. Get tested, know your status before you enter into a pregnancy.
And finally, what would you say is the most important message for people to hear?
Again, get tested, know what you have, learn the symptoms of STDs. So if you really are experiencing some of those symptoms, be sure to get in and know if you do or do not have an STD or a sexual transmitted infection.
All right. Well, thank you so much for joining us this month.
Well, it's good. I'm glad to be here. And again, the message out there is know your status, get tested.
For a list of resources and tips on how to prevent STDs, visit ISDH's website. You can find a link to it in the comment section below this video. We've also provided a link to a map of STD clinics in Indiana, so if you'd like to get tested, you can find one near you. And if you'd like help finding prenatal care, call the Moms Helpline by dialing 1-844-MCH-MOMS. Until next month, thank you for watching the April edition of Pulse.